Here I go. You'll hear the announcement. Here we go. So, welcome to the Mood Disorder Support and Education Group online. I'm Cindy Jones, and we have tonight Dr. John Beyer from Duke University, a favorite supporter of this group and a community advocate. Dr. Beyer and I have known each other 20 plus years. You've been in the field active as a researcher and a teacher, a beloved teacher. I heard a lot of feedback from the residents about you. And Dr. Beyer has been very helpful in talking about what are some cutting edge trends for treating mood disorders or concerns about mood disorders. And so we thought we'd have him come back and talk kind of about what he's finding out. And along the way, people, please feel free to type a question in the chat and I can field the questions. And we'll communicate like that. And when we're done kind of with the part with Dr. Beyer, I'll stop the recording and then we can have a little bit more freestyle and your faces will show. What's on your mind, Dr. Beyer? What do you got to tell us?
Well, actually, I thought what we might start with is kind of just a discussion a little bit about what lessons we've learned from about the pandemic and mental health, if we could. I don't know if that's something y'all have talked about before, but obviously the pandemic has not been the most beneficial for us as far as anxiety and stress goes. And I thought what we might kind of reflect on is a little bit the lessons that we've learned over this last year. One of the things that I think first that we've learned is that pandemics and the consequences of changes in our life have made a significant increase in anxiety, depression, and just trauma in general across the board. Y'all may have seen that about 2 months ago was released the most recent research from the CDC that looking at the early results of the census. And in the census, they always ask a question about how much stress you're under, or have you had a significant stressor? And that answer was significantly increased across the board this last year. In fact, if we're taking a look at the number of people that are actually going into being seen by healthcare professionals, by therapists, or by psychiatrists, going to their primary care doctor, talking about anxiety or their depression, that has just skyrocketed over the past year. It is just uncanny about how many people are really dealing with anxiety. In fact, halfway through the pandemic last year, through our clinic here, what we're saying is what we're seeing unquestionably just anxiety. And it was just significantly increased. So much so that we actually had to start having special discussions about how to treat anxiety in the pandemic, what kind of things you do, and come up with almost kind of a pandemic CBT, things that we would give to people to kind of use to kind of control anxiety and the depression as well. Probably the second lesson that we learned during the pandemic is that some of us are especially lonely, but not everybody. We had the stay-at-home orders for months on end, and social distancing often leaves everyone isolated. So it makes sense that people would say, hey, yeah, I'm feeling lonely. I think in one study, 1 in 7 adults prior to the pandemic actually said that they felt lonely at times, and that was even up higher than it was back in 2018. However, after the pandemic started, when we asked the same question, how is it affecting you? Are you feeling lonely? That answer positive just skyrocketed. A lot of people said yes, they really feel disconnected, especially if you're not able to go visit family members, you don't see friends for an extended period of time, you aren't even able to reach out and hug someone or even shake someone's hand. There's that sense of disconnection from others or loneliness that many people really responded to. Interestingly, not everybody did. In fact, many of our patients that really struggle with social anxiety actually found the pandemic to be much more easy. They found that they were staying at home and they didn't have to go out and see people. They weren't put into positions where they were put in anxious situations as much as possible. And a lot of people said, yeah, pandemic's not so bad, actually, having to stay home. It seems normal what they experienced. But I just point out that unfortunately, for most people, loneliness actually started to become a significant mental health problem as well. The third lesson that we discovered in the pandemic is that unfortunately, domestic violence increased. I think part of it is just the stress that everyone was under. Most everyone's daily life changed significantly. Either they were not able to go out to stores, they were not able to see other extended family, they were not able to do their job. Financially, things changed, but all these significant either bad or good stressors occurred, and that seemed to raise the overall stress level that people are under. And when you are at increased stress and in decreased ability to move, some people respond with increased irritability, or especially just even violence towards each other. And so there was increased domestic violence that occurred. And we saw that in a number of reports that were being made to different police stations across the world, actually. And I think what it means is that when people feel disconnected from others and stress levels increase, we always have to be very sensitive about the potential for increased violence that's there. And so checking on others for that became a priority that we had to do in treating others. The fourth lesson that I think we found with the pandemic in mental health was that the effect that the pandemic had on each of us really depended upon our personality or our lifestyle or our demographics. While older people tend to have more health risks from COVID-19, it really seemed that younger people were the ones that struggled more emotionally. So whenever we looked at studies across the world, from Spain, China, Eastern Europe, it really seemed to be that younger people tend to be more anxious, more depressed, more stressed, more traumatized by COVID-19. The same could be said true for women, who also seem to be much more sensitive to the pandemic stressors than men, and probably also more sensitive to loneliness as well. And there's no real clear explanation for why this was true. We have speculated on some of these things. Number one, women seem to be more likely to lose their jobs in the pandemic. Their jobs often were ones that were more in the service industry or industries that were shut down. And so that might have increased women's burden, either financially or put them in different stressors, life situations. For younger people, we thought it just is the disruption to their routine that would be blamed. And that was especially true for college students who had to adjust to their schooling being online. And I might say that probably is true also for high school and middle school students. Elementary students, interestingly, adapted fairly well. It was not easy, but they adapted better than the older students did. So studies across both the United States and in China, that the more the pandemic was affecting people's lives, the more anxious that they felt. And possibly that was reflected in their underlying personality type. Two related traits that seemed to matter during the pandemic was our ability to tolerate uncertainty and our ability to tolerate distress. So no one should necessarily find distress or uncertainty easy to tolerate. But for some of us, distress or just not knowing what's going to happen are much more, we may be much more sensitive to that. And so if we just know that our personality is one that we don't like ambiguity, we get anxious in new situations, novel situations. We don't like change too much. We can be aware that we are at a higher likelihood of developing more stress, more anxiety, more depression during things like the pandemic. So right now, it's those people who seem to be ruminating more or feeling more afraid or experiencing more depression, anxiety, PTSD symptoms are when we find that our resiliency, our toolbox to be more resilient is a little bit bare or a little bit more challenged. And that's one of the things we have to realize. The fifth lesson I think that we found about this pandemic is that it's worse for disadvantaged groups. I already mentioned one group that was under some distress, which is women in general at times can be considered disadvantaged, especially in some of the limitations across the world that they find themselves in. But it finds that your income and your education level really seem to affect the ability to deal with a pandemic. The income, for those that had a higher income or more flexibility, that where they could stay home more likely, didn't have to be put themselves in potential harm's way, that they seem to do better with the pandemic. But if you are living on the margin, on the knife's edge financially, this pandemic just really stressed things out much more. They put you at a great disadvantage. They also put you at a higher likelihood of actually getting COVID-19 as well, because you just had to be out there to make life, to make the ends of life meet as well. So not having discretionary income, being on the margin of some of these things, was a major stress level and major marker for not doing well in the pandemic. The other was the education, and education and income seem to go hand in hand. Whereas we find that potentially more education, the more higher income you can have. But it is also that more education may actually allow you to find ways of dealing with novel situations or the resiliency. It's one of the reasons why we encourage people, if they had to take time off from work, to go back to school, to go find ways of investing your mind, keeping your mind active. And that often is a way of actually fighting stress as well. But it is an inescapable fact that those that are on the lower socioeconomic half of their cultures really had more problems with the pandemic than others. And then the sixth way we found that lesson that we learned in this pandemic was that the effects are just compounded by racism, by the difficulties that are there, that are just inherent right now kind of in our society. Whether or not it's overt racism or more subtle biases, that people of color are much more likely to be physically disadvantaged when it comes to COVID-19, much more likely to get COVID-19, much more likely to have bad outcomes related to COVID-19, and much more likely to experience the stress and anxiety, depressions because of that as well. And so we just have to be aware that that is a truism in our society. We may not understand why entirely, and we're not looking for blame for what it might be. We just realize that that does matter, that there's some inherent racist structure of society that puts people of color at higher risk as well. And then finally, one of the other lessons we have is that employment seems to matter. And again, this goes back to kind of how we find ourselves living in life on the edge. If our jobs are not stable or are not providing enough income, or we're finding we're working multiple jobs, we're having to find side hustles to make life meet, the ends of life meet, we find that that matters how well we deal with kind of this challenge of a pandemic like this. It puts us in more disconnected with each other. It raises the stress levels, and it really makes a difference. Having good, stable employment matters. Then finally, I think I said finally, there's one more lesson. And I talked a little bit about loneliness, but community matters. And finding stable communities, whether or not it is a religious community, a community like this online, or a small bubble community, matters. If you have those, then you're much less likely to struggle with the mental health issues related to our pandemic. I don't know if any of you have thought about any other challenges that might be present or lessons that we've learned about the interaction of pandemic with mental health or with our social circumstances with mental health, or the challenges about that cause us to even have vulnerabilities or resiliences during this time to mental health, I'd be happy to hear from your experience as well. Let me just take a moment and see if anybody has any thoughts about some of this too.
Yeah, I think that the isolation aspect has created a very subtle erosion undercurrent, almost like losing the skill. So even then, when we're getting a chance to get back little bits safely with people, it feels so especially awkward. Like, I don't even know how to do this,
Mhm.
right? So if I'm not like super great socially and I haven't had any practice, it's it's even harder, you know?
Yeah, what are the new rules? We still don't know what some of these new rules are. Do you wear a mask outside or do you not wear a mask? Do you wear a mask if you go inside to a store or not? We're still trying to understand, go to someone's house. Is it okay to go to someone's house? I actually went to someone's house for the first time this weekend, go meet the parents of my son's girlfriend for the first time. And it was awkward. Do you wear a mask inside of someone you've not met? How do you ask someone if they've been vaccinated? So it cares. We're learning new social protocols. For example, we no longer shake hands anymore. I think it's going to be another couple years before we start shaking hands again on a regular basis. I don't even fist bump with people anymore, just because we're learning new social protocols, and there's always that sense of dis-ease, not disease, but dis-ease, and knowing exactly how we should kind of interact with others too.
The chat box is open for questions. I kind of want to ask a little bit from your general doctor hat, what you know about the ongoing effects of COVID, and you know, lots of people have had their vaccinations, but what do you imagine is going to happen with like another round of vaccinations, or just some of that, because there's so much unknown. If you have any information, if you don't, of course, that's fine, but don't get a chance to ask
No,
doctors much these days, you know.
no, unfortunately, I have to keep monitoring kind of where we are with COVID. The nice thing in North Carolina, for those of you that are in North Carolina, the infection, the positive rate of COVID that we monitor, the percent that get tested that actually are testing positive, now is down to 3 to 3.5%. What we had said when we started this process back in March of last year is that if we can get below 4% positive rates, then we feel like we can control the disease. We can be more interactive, be out among life, go to stores, do that. We've only been down below about 4% now for the past 3 weeks or so. So that's good. However, I do want to point out that means that COVID-19 virus is still out there. And I hope that everyone gets vaccinated. I have one of my very good friends is one of the researchers at Duke's lab that helped develop this new technology for these vaccines that the Moderna and the Pfizer vaccines are, that use this new mRNA technology to kind of stimulate the immune system to COVID-19. What we've been impressed with is how safe it is, especially even compared with our older technology vaccines. I think it's important that we encourage people to accept the science, which is this is a good treatment, and we are helping by getting vaccine. It's not necessarily ourselves we're protecting. We sure are doing that, but it's actually people around us we're protecting, because if enough people can get the vaccine, then we can keep this virus under control. But if we don't get enough people get the vaccine, then it's always going to be popping up again. Hot spots will be popping up again. So the good news is that the vaccine, that the percentage is under much better control, not totally out of control yet, but better. Here in North Carolina, by the way, 48% of the people are now vaccinated, which I think is okay. Not great, it's okay. We would like to see at least 75 to 80% vaccinated before we can say we truly feel like we're achieving near this herd immunity you may have heard about, where the virus is not able to replicate in people that have not been vaccinated, and so we have much better control. We're a little concerned that we're at 48% and holding now, about 50%. So encouraging people to say, this is a good thing, go ahead and do it. I kind of liked what Ohio did by putting in everybody that got vaccinated in a lottery to make $1 million. Did y'all see that?
Love it.
Maybe want to move to Ohio for a moment, for a little
Right.
bit. But yeah, everyone that got the vaccine in Ohio got put into a lottery so that they just awarded someone $1 million for being the vaccine. So
Wow.
I like how that they were trying to encourage people to get the vaccine.
Well, I'm gonna hop over. I still have some more questions about that, but I'm gonna hop over to a couple questions that
Okay.
folks have asked. So, Yolanda asks a question I think is also true to our hearts. How do you deal with personal hygiene being a struggle, like getting dressed and brushing your teeth? Like, just that sluggishness that feels present now.
Yeah.
How to, spark it up a little bit now.
I appreciate the question because I will tell you that anything that you can do to try to feel as normal as possible, getting out of your bed clothes, putting on real clothes, day clothes, even if you have nowhere to go, showering, for me, shaving is just the steps that you go through to say, I am committed to being part of this day. And it's actually helped protective for trying not to get in depression. If you find yourself just not wanting to do those things, pushing through and saying, I am going to do it because this is my routine, is an important part of depression treatment. In fact, what we find is that having a schedule of activities is one of the most important things to do to treat depression, so that you just make sure that you go through your daily routine saying, I am getting up, I am going to shower, I'm going to brush my teeth, I'm going to change into clothes, even if I have nowhere to go, and I'm going to change, I'm going to get out of my bed and go to a different room. Just doing those things is part of good just mental hygiene and protection from depression. The other thing is go outside and be in the sun. And it's good to do early in the day and late in the day before it gets too hot now. But just being outside, even if you're sitting on the deck, not doing anything. I don't care if you're going to go exercise or not right now. I think it's a good thing to do. But just being outside is an important thing. Being in the sun is a good thing to do.
Those are great. I mean, I think that even just the little bitty bits of things to get the pendulum going, like even my cats will switch which room they sleep in just to get a little stimulation.
Mhm.
Let's move on to Jonathan Biggs said a comment that the lessons learned seem to all boil down to one point. The pandemic incubated, exaggerated, inflated the existing issues in society. The anxious were more anxious, the disadvantaged were more disadvantaged, the prejudices were more pronounced, etc. Is that a fair statement?
I think that's very fair. I think it's probably fair to say that when we're under stress, we devolve a little bit to our baser instincts. And what we have to realize is that is our tendency, and to fight hard against it. Just like waking up and getting out of bed in the morning is a way of fighting against depression. Knowing that you're under stress, trying not to go back to your to our baser instincts is one of the most important things. Doing something that is good for another is protective, I think, of the pandemic. It reaffirms our humanity. But you're right. I think that's just the observation that is, we're not at our best when we're under stress.
I just really am appreciating the frankness of it. So my question comes back a little bit to, do you think we'll have to have booster shots for COVID? Because that was said in the beginning to possibly expect that after about
Yeah.
6 months after you had your first inoculation.
Yeah. So when the vaccines were released, the information they had was essentially about 6 months. And so all they could speak to was saying that this is protective for 6 months. We don't know how long the vaccine is actually protective. It could be 9 months, it could be a year, it could kind of put us into it might even be longer. We just don't know because we haven't had that length of experience with it. And so when you see Dr. Fauci sometimes talking about that, he'll be honest with you. He says, we don't know. We just don't know how long it's going to be protective. We're doing the studies now, observing how long it will continue to be effective, and that will help determine when we may need to think about something like booster shots. I would remind you that flu vaccines are given every year, but those are not booster vaccines. Rather, the flu virus, which is very similar to the COVID-19 virus, mutates every year. And so they try to identify what are the most likely mutations that are going to happen. And then they design a vaccine to kind of to give that following year to help protect where they think is going to be the new kind of flu pandemic. Some years they get it right. Some years they don't get it so right. But that's probably where we may end up seeing a little bit with the COVID-19 because it mutates. And so what we found is that most of our vaccines are pretty good at protecting against the most common mutations now. However, the virus is always looking to find a way to continue surviving, which is, again, another reason why it's good if we get as many people to get the virus, because it has fewer people that can mutate in, and it will mutate. So probably what we'll end up seeing is that at some point, maybe it's every year, like the flu shots, maybe it's every 3 to 5 years, like some of our other vaccines or tetanus vaccines and things like that we get, that we'll get booster shots or an updated shot to kind of fight against some of the mutants that we may not have, our current vaccines may not be protective against. But we don't know that yet, but we'll be finding that out. I'm hopeful that what we'll find is that the vaccines are good for at least a year, maybe a lot longer, and that the only thing we're going to need to worry about is whether or not we need to get booster vaccines against the mutants, not the COVID itself.
Well, I feel so, starstruck a little bit. We haven't seen each other, and I'm so happy to see you. Sometimes it's like I get a little choked up about like what would be questions to ask. What I think I'm going to do is go ahead and end our recording, so maybe that'll free people up a little bit and we can be a little bit more informal. But on this official, so much gratitude to you for supporting this emotionally, psychologically, and just it's very reassuring to be able to have human to human and learn, okay, it's a big problem, but we're in this together. And just your style of giving information is very calming. So thank you very much.
Well, thanks, Cindy. I appreciate you and your work that you've done on all this.
All right, I'm going to stop.